It's so great to see everyone. Thank you for coming and joining. I feel like your presence here is just also just a sign of how much you care, and we all want to get this right. Today is a open discussion. It's a forum for us all to share. I encourage everyone to jump in and share your experiences, those who have shot, what has worked, what hasn't worked, what's made you feel safe. From both the crew side, the production side. There's a couple of sort of big obvious things that I think we're all working on. Things like everyone should take the Safe Set course, just so we're all on the same page there. Of course, PPE, social distancing, all the CDC guidelines. Look at the state, follow the state guidelines where you're working. And then there's all the little small things that production has always done. And now it's just, we have to do a lot more of it. So would anyone like to start with a production they just have recently shot or been on, and their experience and some tips?
Well, I just want to point out, because, you know, we get a lot of people that pop in and pop out. All of the webinars, all of the Zoom meetings are archived on DC Camera's YouTube page, our channel. And so last week's webinar was how we did it. So we had the first job in New York. We had the PM on that, Maura Hurley, and then Steve Blair and Amy Mayfield did 2 back-to-back jobs in Pittsburgh with a crew of 35 to 45 people. So I would definitely, if you haven't seen that webinar from last week, definitely watch it.
Yeah, and I'd also like to add that production, because we're part of every department, and we always talk to our department, see what they need for every job, you know, just so we can make sure we have everything we need for the job. But now it's even sort of double important. And I would encourage everyone to look at also the Zoom meetings, because there was one for art department, there was one for Grip Electric, there was one for camera department. There's a lot to learn in them. And I want to thank Caprice for organizing all of this, and Arish for making it all happen and hosting it. It's a great help. I think our community is unique in that, I mean, we're all here. And if you look at the webinars, you can see the level of cooperation with everyone. And so I think it's a particularly caring community, and we all want to be safe and we all want to work. So I would love to hear from like Timmy or Jen or Brian about a shoot, or Lynn, about a shoot you've been doing or been on, and how you prepared.
I mean, for me right now, the bigger shoot, because it's just a political year, and every 2 years, it seems like for the last 4 cycles, I end up going under contract. And that's, during that period of time, that's all I do. February was the last retail job, if you will, I did before everything changed. Going forward, I think some of the challenges I have, and I'm thinking of this call, is I'm thinking less about pre-pro and more about day of, like what's going on set, and hearing from people talk. Because when you do a remote shoot, and we're doing very small shoots, my biggest fear with the smaller shoots is that compliance through the day of the shoot becomes a challenge. That, you know, people get, you know, we're used to doing things a certain way. We're used to, you know, even just lunch, making sure people realize they've got to sit apart, but even making sure we're not handing things off, you know, making sure every time there's a place where people come into contact with equipment that we're maintaining distances. I wonder how other people are doing this, because also in the smaller shoots, unlike the white paper, which, you know, in bigger sets, you've got a hygiene person, you've got a compliance person, the producers, we're having to do it all. Basically, I talked to May Tam recently when she worked on the Gatorade shoot, and what she said to me was like, making sure everybody understands it just takes more time to get this stuff done and to maintain it. So I wonder what other people are doing on set. I mean, I know for me, it's a constant thing. We just drilling down. I know we're like less than 10 people. You think it's easy. It's surprisingly hard with 10 people that are working towards one goal. So I put that out there. what people's experience have been on set.
Yeah, and I did a little research on that, and I talked to Cindy, who had a job, and there's really, it's sort of basic stuff like, of course, sanitizer and disinfecting, but also like, I think it's going to mean more PAs because there's a PA just for walkies, even on a 10-person set, because they sterilize them. They put the they put them in Ziploc bags. They hand them off. Only one person touches them. Then when they need a hot brick, it's already in a bag. They take the other brick back, go somewhere else, sterilize it. So something like a walkie. But if you think through every single little thing we pass around on set, that's what it takes to keep it safe. So I think it's definitely more PAs, but then you want to keep your numbers down. So maybe
Right,
a
yeah,
PA
right.
in a pod that's somewhere else, that they're not on set, like a support team that's easily socially distanced, but that goes back to locations and where can we put them? Because you can't just say, oh, we'll be outside, because what if it rains? So
Yeah,
yeah, and then like lunch, one thing I've talked to several of our friends, and what people are doing is just giving people per diem and asking them to bring their own cooler. So
which
you
is
have
what
your
I
own
like.
cooler with water that production has paid for, but it's not a bunch of hands in the same cooler.
Yeah, absolutely. Yeah, that's where we landed. Like coming into this, trust me, from a producer standpoint, trying to sell that into clients, they're like, because even our clients are like, "What are we going to get on set?" I'm like, "You're not going to get anything."
Right. When's the coffee run? Yeah.
No, it was funny. Caprice knows, as I was just talking about, I had to tell him, like, there are no Starbucks runs. That's not happening. And
Yeah.
more clients decide to do it remotely anyway, that kind of falls away. But early on, it was like, we had to tell them every notion and every way you've done everything, you have to think about it. And it's not going to be the same. And I don't think, let's say we get a vaccine in January, it was the first quarter of next year. I don't think these procedures, I think many of them are going to remain. I just don't see them falling away.
Oh, it's not. This is we have to create, and I think we have to create it collectively by exactly what Caprice and Arish have set up. So we really, I highly encourage everyone to watch the G&E Zoom call. Dan Stack had a tremendous tip on there about sterilizing tablets that are used in the food industry called Steramine. You put those in water, you buy your spray bottle at Home Depot, and again, you write people's names on them so people don't touch other people's bottles. But sterilizing everything, I think surfaces are going to be easier than airborne. But and I do want to go back to more production managers and producers, but I'd also like to hear from crew and your experiences, and where you've been and when you felt safe and what you thought was a great idea and what gave you pause, so that we can all learn from you.
Well, I'll just jump in. So if anybody wants to learn anything more about disinfection, that was on the second webinar. So there's a lot of good information on there. And and I hope people do not get in the habit of having production assistants being your hygiene crew, because you really should have professional people that understand you're bringing chemicals on the set. And
Sure. I just meant like a walkie PA.
Oh yeah. Oh yeah. No. But that's the one thing
That's really true. That's a really good point. And also professional cleaning crews.
Right.
I actually turned a job down because I didn't see how, when I was talking to the company, I could do what we need on our end and keep it safe, and in what they were presenting. So, I mean, I think professional cleaning crews would give everyone assurance, but it's all scale. It's all about the size of the job. So anyway, I'd love to hear from any crew members and your experience.
I can kind of, wrap some things. I'm just trying to guide some things because I don't want to spend a lot of time on certain things like disinfection that we've had a webinar on.
Sure.
But geez, I mean, I have since March just been trying to figure out like how, especially my department's going to work. And I'm sure everybody has gone through these scenarios in their heads. Like for me, And we'll talk about this next week, which we'll talk about locations. And that'll be the webinar, and the Zoom meeting will be all about locations. But, you know, I mean, we bring in so much stuff. And again, we'll be scaling back much more, but we ooze. So even we're in a big, big house, every single department, I mean, we take all that real estate, you know, every bit of real estate, the front yard, the backyard, even in a big house, we're in every room. We are, you know, we typically in this area get a motorhome. And who's in the motorhome? We have all the talent, makeup, wardrobe, production, the driver, and that's not going to happen anymore. And also too, when you're bringing up rain, I'm petrified about that, because if we have to take cover somewhere, you know, where is that going to happen, you know, safely when we're supposed to be distancing? So I'm sure maybe we open up the conversation of, with everybody, like, what's been your concerns? What's the thing that's kept you up? You know, just trying to think about how you're going to rework things.
Well, and I'll just jump in here. So, you know, we've had these discussions now that, you know, when we just even temperature taking, just that simple fact of not creating a situation where you create an area of transmission, because staggering calls, getting people in. And it's interesting, you know, I've gotten buy-in mostly on much smaller crews, but it's, you know, getting those people in a timely fashion. We don't have typically, you know, the grip and electric department is shrunk, but we still need time to disinfect. We need to set up, disinfect. And I keep coming back to, and locations is one of the things next year for me is going to be more of a, well, I don't want to say right now, my consideration, all my locations are voluntary, which means it's somewhat difficult to say, yeah, thank you very much, but that's simply not going to work anymore. I need lots of space where I could, you know, and we're in production. People ask, can you do it? And what do we do in production? We'll make it work. That can't be our answer anymore. Our answer has to be, I need resources, because it's not like, yeah, I mean, look, I was on a shoot for reality TV. We all worked out of a motorhome. We caught dysentery on break. I mean, this was years ago. I can't even imagine that now. I mean, so when someone says, hey, we're going to do this shoot, as long as, I mean, most clients, I think, get it. But even like a PA, I mean, needs to be aware of what they're seeing going on. And this is what I talked to Nancy, what I was saying to Nancy early on. You know, we start a shoot with great intentions, and the day goes on, and everybody needs to be vigilant. But hey, this is falling apart. I need everyone up saying, hey, we got to make sure, stop. We need the space to spread out. In the morning, staggering, temperature taking, get going through the checklist. How are you feeling? You know, all of that stuff. So lunch, we do a per diem standard. Where am I able to send you? I mean, there was a video that Mary Holland sent out that was really interesting. I sent to my clients, and basically it's like, take your 8-foot table and put 2 people at it. No, you know, and how many of those do you put out? Luckily, right now I'm doing crews because I'm all over the country, and basically for any number of reasons, we're not going to go over 10 people. We're just not, we can't. State restrictions, concerns from clients and my directors, it's just going to be better. So, you know, in their first thought, oh, we don't need that much space. I'm like, yeah, you really, I mean, lunch could be the biggest space I need of the entire day. And just making sure that everybody is aware that things can kind of fall by the wayside. Just everybody wash your hands, avail yourself of, you know, I have wipes going out, masks going out, hand sanitizer going out. Makeup, we've temporarily suspended doing makeup right now because no one's got a comfort level, and no matter what we say, it will always be up to the talent whether they're comfortable with makeup happening at all. And that's a whole nother level. And we're talking UV sanitation on set. It can be done. Again, it's other resources. Your kit fee is going to blow up. I've already, Terry Troop and I actually worked on this in February of trying to put together a specific kit per person. Like, you don't share any brushes. Everything is unique, sealed, just like the walkies, right? And then what do you provide for sanitation? And, you know, our kit fee, you know, $50 for kit fee for the day. You're talking $100 and some per person for a female kit and a distinguishing one for a male kit. And that's making some kind of assumptions about what you're going to need. It is making sure we have all these things and people are utilizing them, though, because the biggest thing I have on set is just absent-mindedly you revert to form, and you do that thing you've been doing, or you walk over and you look at the monitor right next to the DP because you've always done it. I mean, that's why I worry about me. I mean, I have to police myself, but everyone has to police each other, because we care and because we're looking out for everybody. This is not accusatory, and we're not trying to take the time, but we're doing it for our clients. We're doing it for ourselves. I want everyone to feel, I don't want anyone ever on a set feeling unsafe. You shouldn't have to make a living, worry about that. But it really does mean rethinking the simplest little thing. And so, and like I said, we've kept our stuff very small right now, but I anticipate, for me, the problem is going to come in August, when we just can't put off these shoots anymore, and we have exhausted any creative, ways of doing it in post, and we have to get out there. This kind of, I don't want to say mad rush, but I'm worried a little bit that there's going to be this mad rush, and so we just have to stay absolutely vigilant. And I've polled people afterwards on set, and everybody's like, "Oh yeah, things are great." I think people are just happy to work right now, having, I'm next to California. I have a shoot, in theory, scheduled in August in California. Okay, sure. I'm looking at what I've got to do there, and I have to start what I used to prep in 10 days is now taking me 30, easily. Because I'm also having to look at different resources that I never had to look at before. Anyway, I'm monopolizing this, and I didn't mean to. You know me, Caprice. But I mean, if anybody has been on set and just seen something that really works, I would love it. Makeup is, I'm worried about what we're going to do. If someone has, when they worked with a makeup department and seen something that made talent feel safe and they'll feel safe, I'd love to hear that, because I unfortunately have not been able to put it in practice yet.
Right. Well, we again, that's why we're doing this, to share information. And I said last week that, COVID is not proprietary. We should be sharing information to keep ourselves safe. So the last webinar, we'll have vanities on, and I've got 2 women from Los Angeles, one a makeup artist and a wardrobe person that has been working. And they've told me they've got a lot to say. So,
and I want to hear it.
Yeah, so that'll be July 29th. So unless someone here, Terry, you look beautiful.
Always, yeah.
Yeah, so we'll be doing that in 2 weeks, and hopefully that'll help out with a lot of people. But again, like Brian's saying, as we're working, sharing information, how-tos, I almost feel like we have to do like a walkthrough production, to figure it out. But, and also what Brian was saying is, we have to retrain our brains. We've been doing this for a really long time. We're very dialed in. We're very talented in our respective departments. And now, it's just all different.
It's actually a unique perspective. If I was young coming up through this industry now, knowing that the paradigm has shifted, I think it's a really unique way for people to come up learning the craft in a different way and to be really effective. I mean, in some ways, I'm an old dog, right? And I'm having to relearn this stuff. I think if you're coming up in this, if you're a production assistant right now, in a strange way, you may be in a great position to be much more valuable later on because this stuff intuitively. This is how we do a set. It's like when technology changes, if you're able to latch onto that and know it, and now this is going to happen. So, anybody here that is just starting out in production or even in an assistant position in any department, you have an opportunity really here to embellish your skills and become, well, I think really incredibly useful and valuable in the future. Because no matter what, we get a vaccine, let's say, and let's say that 75% of the production teams and clients feel very comfortable. 25% won't. And that means that all these things that we do in terms of precautions are going to stay. We can't, makeup is makeup number one. We're always going to have to be talking about that. So I think this is a unique opportunity, if you want to look at it that way, to develop some skills, to market yourself as a production person. Having known how to work in a COVID environment, safe sets is definitely one way. I would say that's like first thing to do. Just as a bare minimum, start there. and then use your experience on set. I know as a producer, and sometimes I think next year I may well, because everything's going to be so remote, I may get jobs where I'm just the coordinator because the producer's going to stay back, but they want someone with experience to just kind of execute. And I'm like anyone in production, a production assistant comes to me and say, hey, how about we do this? I'm like, absolutely. Show me a way to do it because we are all learning. Okay. And
yeah. And I invited Lynn Hughes, who did a shoot recently, to join us. It was with a med team doing COVID tests. So since she worked with a medical team, I thought it'd be very interesting to hear the steps they took to keep people safe. So Lynn, if you wouldn't mind sharing with us.
Hey, sure. Yeah, Sheila Smith and I worked for a few days with CORE, which is a nonprofit that's out doing pop-ups for COVID testing in, this was specifically around protesters who needed to get tested after being out in the streets. And I think we learned a lot of tricks from them. I mean, for us, there were only 4 of us on set at a time, just to keep the numbers small. But it was the little things, like Brian was saying, when we first started, because Sheila and I had been out shooting B-roll independently for a couple of months before on some other projects, but it was really just the 2 of us. And being out and working with a whole group, this was a big deal. But, you know, going back to Crafty and things like that, Crafty, lunch, and bathrooms were like the 3 biggest things. There are no public bathrooms anymore. I mean, they're not available. Starbucks, if you get lucky, Starbucks has bathrooms and they follow a really strict policy. And so, you know, that's where I stop whenever I possibly can. But we were very lucky because of the team we were working with. They had to have a space for the medical team to use. And so we lucked out with them on that. But I can tell you the way things were set up, we were all outside. So this would have to, I think even if you're working inside, this could actually work. I think there's going to be a lot of investment in light portable tables and pop-up tents, you know, those little ones that you see on the beach that people put up. And so everything in the set was divided into different areas. There was contaminated and not. And there was a process that, you know, when you got your PPE on and you went out and started shooting, the minute you came out, you decontaminated. And within that, they had little things that I had never thought of, but like they had bug sprayers with the little hoses that they had filled with disinfectant. So anytime anybody sat down at a table to work or to eat, when they got up, you just kind of went around with the little bug sprayer and decontaminated the space. It took 2 seconds. It was super easy. So it was things like that. But I agree with Brian. It's going to take a lot more time on the planning stage, but you're also going to have to think about how you section off your groups like that. We started every day with a refresher on how to put your PPE on safely and how to take it off, especially gloves. All of us wore gloves all the time. That's something that people just don't think about. We're so used to being in it now. We assume that everybody knows. To keep some of the costs down, the same thing, you know, names went on water bottles, names actually went on, you know, if you had washable gloves instead of disposable gloves, anything that could be reused got your name sharpied on it. And then it was just kind of the basics. We did a bunch of MOS interviews. Again, everything was boom. We didn't use mic for anything. And then the most I was aware of contamination was media management. Every time you're passing off a card, so Sheila would disinfect the card and hand it to me, you know, like in a box, so that she didn't have to touch me, and I would take it, and then actually we passed it through the window of a car. So she put it on my passenger side, and then I would pick it up. And the same thing with the card reader and every single cord. And it just, you know, it's like those kinds of steps that you don't think about. You know, surface contact transmission is really low, but we can't be taking the risks.
Yeah, I mean, we just put together procedures regarding DIT exactly that way. And I was literally like, to deliver the PPE, to get the PPE, it's like step by step by step. And it seems stupid, you know, but it's like, people just assume they know what they're doing. I'm like, no, let me lay it out for you. This is what has to happen. Disinfect it. It goes into a non-common area that then we never hand it off at all. But you did bring up something that was interesting when I was listening to it. And I know it was a health organization. I believe the white paper that went out, and this is something we decided we have gloves, but we're not using them. And the reason is this, is that most people, even when you train them, have a tendency to get this false sense of security. And so they put the gloves on, oh, I'm okay. And they do whatever they're doing, and then they do this.
Yep.
And then they don't take off the glove. I mean, it's as simple, go to the grocery store someday. I remember this is how I went to the grocery store, they're all wearing them. And I realized this person before me, they go through all their groceries, they never took off their gloves. And think of it when you go into your doctor's office, they do a procedure, they're gone. And the white papers said essentially this, is that most people don't know how to use gloves. What we'd rather do is sanitize and wash much more often, because the risk of even one time forgetting with the glove, because I'm good, right? I've got my glove on. So we're right now not doing gloves until we get any further guidance. We have them and they may well work, you know, in the DIT area, for instance, put on a pair of gloves when you hand it off, throw them away. But you know, just the average person who walks over and moves a piece of equipment and doesn't take those gloves off, you know, all day long, it becomes your second skin and you can transmit from there. So it was interesting that you said that, but like I said, we're just, we're going to not do that, but everything else, I mean, I've got bottles of sanitizer with me right now that I can send out to other producers, and COVID wipes and PPE. And again, keeping it small too, like you said, it was interesting. Your crew of 4 people is probably more indicative of what I'm going to do. I don't anticipate getting over 8 people for the majority of my sets this year, just because anything over that, I think people get nervous also. It's a big thing. If I'm not mistaken, and someone could correct me, Jurassic Park, when they started shooting, ended up in the first part of their quarantine, someone came up positive, and they luckily, because of the quarantine, were able to kind of backfill and do that. But you know, the more people, the more risk that something will happen. Anyway, I'm sorry. Hey, Terry.
Yeah.
Would anyone else like to add an experience they had?
One more thing, Nancy, can I just add on what Brian was saying? I agree on the gloves, and each of us actually had personal hand sanitizer that we walked around with. When we were in a hot zone, you actually had to have the gloves on. But like you said, DIT, makeup, wardrobe, you're going to have to be using gloves. There's going to be no getting around it. It's going to be a one and done, because you want them put on fresh before they're working with anybody. But there are going to be aspects of this where we're absolutely going to have them.
Yeah, and I think the critical thing too is to have a meeting every day, and we'll send out your guidelines in advance that are in alignment with the industry guidelines and the union guidelines, and send those out. You have the AICP questionnaire. You've got to get God knows how hard it is to get back documents before shoot, like NDAs, and now we have, but the AICP questionnaire is critical to have that returned before you go on set, do the temperature checks. But then the safety meeting is of paramount importance. If you have an AD, of course, they would do that. If it's small and there's not an AD, you have to make sure you run a safety meeting, I think, every day and before every shoot, or if there's a company move, always be cognizant of that. Anyway, Lynn, were you going to add something?
Yeah, there were 2 other things. I think the temperature also, I don't know and I haven't, because I haven't dug in and looked at all of the different templates that are going around about safe sets, but pulse ox monitors are actually almost more important than temperature checks, because pulse ox is going to tell you quicker than a temperature is if you're dealing with a potential COVID situation. And they're cheap and they're easy to pick up. The second thing is the setup time. I'm just, before you start, you're going to need to add at least an extra half an hour, if not more, just to set up your zones.
Yeah, more.
Before, yeah.
Lynn Quinn, did you have were you going to add something? Hi.
Hi, good afternoon. It's great seeing everybody. Um, in bidding jobs, I feel like with clients, they're playing the what if game with me. So
Right.
they're always like, well, what if the DP shows up and he has a temperature? What if suddenly there's civil disobedience and the DC breaks out? What happens then? What if we have to cancel and it's 7 days before? What if it's the day before? I have just been bidding jobs and then rebidding them, talking about all this stuff. It's exhausting. But my main question to you guys is, what do we do if we show up and somebody has a temperature and it's one of our key people? I mean, does anybody have any ideas? Kind of, I'm not sure.
Well, actually, we talked about this earlier today. What we're doing right now, we're going to the old rain day scenario. When we're booking days, we're explaining to clients that, look, it could be one person that morning and the whole we have to stop. And do we have a rain day where we can reconstitute crew? The other option that we've put out that we've not, and I just had a conversation with one of my clients this morning about it, is you potentially could double crew your entire shoot. And so when we were talking about as producers expenses, I know, I saw your face, I know. So for instance, if you keep a crew, but if you do keep a crew to like 5 or 6 people, it's not as horrible, but basically what you're talking about is a single day shoot from a labor cost perspective becomes a 2-day shoot. And if that shoot is crucial, in other words, you can't move it, it has to happen now, this is a cost you probably are not going to have a choice but to do it. And then it gets into whether a client wants to go a different creative direction, go into animation, do it all with B-roll, whatever. But I mean, someone could replace themselves, but typically speaking, we don't care about the temperature the night before or what have you. We care that morning. What is your situation that morning? And if it changes from the night before to that morning, replacing yourself is very difficult. And to put that on a crew member is a lot. So we as producers have got to, what are the options? One is to reschedule the shoot. And unfortunately, if you're calling it that late, you're paying for that crew anyway. I mean, part of the COVID, unfortunately, if you can predict that rain's going to be bad before 2 o'clock the day before, it's a completely different situation than the morning of. But these are the kind of things that clients are going to have to understand. It's part of the way we produce now. You simply don't have other options. So yeah, I mean, those are the things you have to do. Is it a difficult discussion? For clients that have bigger pockets, maybe not, but I'm sure you have clients that are like, oh my gosh, they were just gathering, John Noble earlier today was like, his budgets were put together in 2019. They didn't anticipate any of this. So, but those are the realities of just having backup. You can't magically, if you have a key, if your DP goes down and you don't have an operator, then you shoot. So you can only discuss it in the beginning and say, look, this is the what if. It could happen. It could happen.
Like that's one reason why a lot of my clients are saying, I think we'll wait.
Yeah, no, definitely. Yeah. And we were talking about this earlier, that people are pushing in everything to the fourth quarter. Well, that's assuming things are, 2 months ago, everyone thought July was going to be the go-to. Like everything's going to happen in July. And then all of a sudden you had states regressing. And just 2 weeks ago, I would have even said it. So we're going to see fourth quarter. I'm not sure it's going to be fourth quarter, but I certainly, as you're talking to your clients, and I will talk to mine, is like, if you're planning for 2021, this is your new reality. Put these in your budgets for 2021. Because to a certain, if you're talking a product launch, Caprice mentioned this earlier, in Moab, potentially we think that was the Ford launch of that vehicle. There's no do-over there. They have it. It's going to have to happen. I'm working on politics. November, all my stuff has to get done. If you have clients that can push it off, that's great. But at a certain point, if you're talking a product launch or anything like that, they start talking missed opportunities in the marketplace. And then really to save an extra day of shooting time, is that worth missing the market? Hopefully they can get to that. But really, when we talk to them about 2021, these costs they should really be planning on this kind of stuff, thinking through it. I mean, even if we do get to a miracle of a vaccine, I think there's still things that are going to happen. I really do. I mean,
But
there's
then,
people,
can't people in production, can't they ask more of crews? Can't they ask more of IATSE? Can't they say, you know, I'd like you all to get tested before, you know, I'm scheduling a shoot 2 weeks from today. Would you get tested so that when you do your health questionnaire, you will have had a test under your belt?
here's the problem is,
Yeah,
the problem is that that test result doesn't come back for 5-6 days.
That's
And
the
so in that
problem.
time, they have to
But the
quarantine.
testing's getting better. I mean, just yesterday they announced that this fella, you know, in, I guess it's Arizona, you know, has now put out a test that where you get your results back in minutes. Now they are trying to like start exporting this, but just like everything with COVID, this is changing ground. And I just think that I don't think anybody is really trying to hook up with pathology department. No, but I mean, who of you all are calling Johns Hopkins? We're trying to make a relationship with somebody that's in the health sector that is like you were saying, look, I have crews, I have these people, they are little microorganisms. If one person gets sick, they're all going to get sick. They're all going to take it back to their families. They have kids. This is important, you know. I don't think
The problem is there's any number of organizations that can say the same thing right now in terms of, you know, just testing. I myself have been tested twice. I went to the hospital and got a test. It was very straightforward. And the second time, in order to do it, I ended up in a Walmart parking lot at 7 in the morning waiting for a test. And the problem is like getting an organization to say, look, I've got 10 people. I need to get this test done. They're hearing that from a lot of people. Right now, it's still not,
We don't have rapid tests. Only the White House has those. Yeah. At least, Marie, were you trying to? I saw you had your hand raised.
Oh, I was going back to the discussion about backup crew and rain dates, and especially thinking about these smaller jobs, smaller non-union jobs specifically. I think if any crew member needed to have that backup person on standby, it's the producer. I mean, obviously director, the shooter, whatever, but the producer, especially on these small jobs, because we're the ones that are going to be the hygiene department. We're the ones taking care of everybody else on set. And if we end up with a temperature, fever, symptoms on set and have to go home, then what's the path forward for that production? Who steps in and who doesn't?
Yes, Terry.
It makes me think about who I'm going to put on my set. You know, I think about people's lifestyles, and so I feel like I'm going to get really picky with who I'm putting on my set, so that they live a lifestyle that is one that is going to keep everyone safe.
Right. Well, yeah, we talked about that in the first webinar. I know you producers, you know, you have the crew that you like because of their talents and typically that you hire. But yeah, no, if I was a producer and, you know, calling me and you know, Lynn, if you called me and you said, hey, Caprice, what have you been up to? And I said, I'm taking this seriously. I'm isolating in the house as much as I can. I'm doing very low risk things, you know, and then you call, you know, somebody else in locations and you go, hey, what have you been doing? And then they go, oh yeah, I was out at Sunset Cove Saturday night, had a blast. Yeah, then, you know, you're not going to probably hire that person. I did talk to Dave O'Farrow about the whole backup crew thing the other day, because I knew it was going to probably come up in the webinar today. And Mary did, or somebody did touch upon it on the website, that maybe there would be a little bit of a loosening, that, you know, you could put crew on as a first right of refusal and say, you know, we have our A team set up, you know, we're putting you on hold, and just see whether or not how that might go. I mean, that's going to be further discussion.
well, you know, hotels have had to at great personal cost to them. But since there's no travel insurance anymore, hotels have had to say you can cancel your booking right up to the day of. And
It's
you know,
like-
I mean,
yeah.
a lot of people have had to make special
That's right.
concessions to try to get work during this time. And I feel like it'd be great if IA would, like, you know, with the local especially, would be like, yeah, okay, what can we do to help you out? Like, you know, how can we like have a couple of people in the wings in case you end up needing them on short notice?
Right.
Barry, do you know, has anyone actually asked that? I mean, I've talked to the AICP guidance said their belief was that that IA would do just what you're saying, is that as things came up, they would work with producers to develop procedures that worked within COVID, right? So, you know, traditionally, if you're going to release someone you've had on hold, you need to know the day before at a certain time. That doesn't quite work in the situation. Has anyone ever asked the union, in particular, be it for one particular production, about those guidelines so that we could do exactly what you're saying, have a backup and not violate rules by saying your first right of refusal, we won't know till morning of, per se?
Well, Capri says that David seems a little, seems open to it as in a general sense. I mean, I don't think you were discussing a specific job, were you, Capri?
No,
Yeah.
I just, you know, we just talked the other day and I just said, you know, has anything, give me the latest and greatest, because I have a feeling this is going to come up on Wednesday.
I'm just trying to put the different thought, you know, we've all, like, you know, I mean, it's the union's job to keep everybody safe. And so we as producers and production people, we're always saying, well, we're just going to take, you know, we're waiting to hear from the unions. We'll take what their word is, and that's what we'll go with. But I feel like now we're all this has made all of us partners in this, and we're all going to suffer. I mean, it's not just going to be you know, the cost always ends with production. It's like the production always ends up eating costs. The clients are going to be like eating costs. So the idea is if that pain is on them, you know, the financial pain, what can other aspects of a production do? What can other people do just to kind of ease that pain?
Right,
Not
because the
necessarily change anything.
The double crew kind of thing, I feel like, is just not going to fly with the clients.
Yeah, it may not. I mean,
Yeah,
you know,
paying to have a duplicate crew that you may or may not need it's hard enough to get them to pay for a weather day, isn't it, Lynn? It's like,
in essence, you're doing that. I mean, if we could get like a nominal cancellation fee on a late minute hold and release, I mean, that would be a great thing for the union to say, like, if you put someone hold and you release them that morning instead, and you pay a 25% cancellation fee, that's certainly a lot of savings and provides you protection. I mean, that would be a great procedure for the union to step out and say, that's how we're going to address COVID. So you can back up your crew at a quarter of the cost.
Right.
No, I would love to hear that. When I've taught, and Caprice, I talked to David, I think Friday was the last time I talked to him, and I said, has anything else come up? And I think it's pretty much the same conversation you had, is that nothing specific has come up, you know, maybe because it hasn't. I mean, I don't know, maybe no one's suggested this to the union yet or not. And I certainly haven't, because I haven't had to put it into play, but I'm pretty sure I'm going to.
Right. Well, I'm sure that it's in play, but Beth Bell has a question about, you know, if you're sending somebody out to test, should you be paying them? I mean, maybe this is part of the courtesy, you know, like, I'm not going to charge you my day rate. I'm going to go get a COVID test. You know, what are you guys thinking? I mean, again, do they keep occurring all these
I
costs?
think the producer should pay for the test. I don't know about how much they should pay for the time taken for the test.
And she's
but-
saying paying for the time to go take the test.
Yeah, no, I know she's asking. I don't know how you would kind of, how you would set that, but it's certainly worth, I mean, you're going to be paying for, we're talking preventative measures right now, right? So they're already paying for the wash stations, the extra PPE, that this is all preventative stuff. So, you know, you know, depending on how many people on your crew, if you've got 2 weeks notice and you're doing all of this other prep in order to, or 30 days in some cases of prep to make this place safe, I think you could certainly ask them to front the money to pay for a test.
Yeah,
It doesn't necessarily keep people, you know, I mean, it shows that you haven't had it that day, right?
right.
But how nice to know that everybody going into a set has been tested recently. I don't
Go
know.
ahead, Beth, you brought the question up.
Yeah, I know. Well, the
definitely
reason I
great.
brought it up, I mean, I belong to the Reopening Hollywood group on Facebook, which some of you might belong to, which is a huge cross section of all the different departments. A lot of them are based in California, but they're also members from all over the country. And there were a couple, you know, there were like several people who'd been on some small shoots or, you know, like went in to wrap a show for 3 days or had a 2-day commercial shoot and whatever. And, you know, the majority, I want to say all the ones that were union, you know, I think, you know, it's like some kind of negotiated 2 to 4 hour rate to go get a test. And the people that are saying, you know, but if you want the job and you want the money, and, you know, most of them are like really young and just like super hungry. And they're like, you know, and then, you know, it was like, actually it was like a bit of a discussion on there because it's like, no, this is our time and we need to be paid for our time. This is a part of the new reality. And if Budweiser, you know, is going to shoot a commercial and they're like this huge multinational conglomerate, you know, they can go pay an art director or a set dresser or a grip for 2 hours to go get a COVID test. I mean,
what about the smaller shoots here? Then what?
I mean, I don't know. I mean, it depends, you know, again, it depends on the, you know, it depends on what you're talking about smaller shoots, you know.
I think it still applies, Beth. I think it still applies. I think a production should pay for any pre-pro time, you know, and that.
Right, and I mean, getting a test is part of that. And let's say you have you're an art director and you've got a prep day anyway to go do some, you know, buying or whatever. You know, maybe you just have to include, you know, 2 hours at a CVS or whatever the heck it's going to be to go get the test as part of that prep day or however you're going to manage it. But I think it's a lot to ask somebody to donate their time to go get a test when if they were just sheltering at home anyway, like, you know what I mean? Like they're not going to go get a test. But if they want to go work on your job and make your commercial or your video for you, you have to pay them for their time. You know, you pay them for their time. I don't know. I mean, I think that's what's fair. I don't know. I mean.
But again, I want to go back to something because we've talked about this as producers. The issue has been the real-time testing, and I'm not sure what the accuracy has been attributed to in the Arizona test, but the real-time testing is only proven to be at most 70% accurate in most times. So that from a liability standpoint, if you get a false or positive test based on inaccurate testing, it's a huge issue for, you know, based on behaviors. The other thing is if you go and test, and at this point nationally, we're looking at least 5 days to receive the tests, unless someone is willing to isolate between the test and the job.
Yeah.
It's quite frankly, it's useless.
That's, yeah.
And then the question becomes, do you pay for that time? Because you're also saying to that person, if they're able to get another job in that interim where they may or may not be tested, but they can't go. I mean, it's more than just people's social activity. If, you know, hopefully we begin to have a thriving production community, but it will be a difference between, do you take a job today and a job tomorrow and the job the next day? If indeed you're factoring in testing to this, that becomes an impossibility, because in order for testing at this point to be accurate, we need to know you took the test, you isolated, and so the test has meaning when you come to set. Because otherwise it's not that useful. And again, I know we're trying to protect each other, and the ground on this is moving so much. You know, we at this point have decided that we're not doing testing. We're absolutely doing all the screening, but it's not really practical until there is an accurate real-time test first.
Accurate rapid test.
Yeah, rapid, right,
That-
real-time
that-
rapid test.
Because otherwise, if I've done 2 tests as well for different reasons and negative, but same thing. It's like
Yeah.
after you get the test, then you have to quarantine. The first time was only 3 days, but the second time was 7 days.
And in that time, I
So
mean, we're
you
not,
get the results, because if you step out of your house,
go grocery shopping.
the
You're
test, so the
done.
test, until we can have a rapid test, and even the antibodies test, I thought, oh, great, I'll get the antibodies test. It was negative, but that, if you test positive for antibodies, it doesn't necessarily confer immunity. So
Right, I actually
there's
did
really
have-
not enough science. Everyone has to be very, very careful. And going back to being careful, I think another important thing to talk about are masks and breaks. Because if you're wearing a mask, you need a break. If production and G&E is there early, or locations, they need time to take the mask off and breathe and be in a safe space. After whatever it is, I would ask anyone on the crew to say, I need a break, when they need a break. Set breaks, set times, but also people have different tolerances with masks. And I think it's important to schedule breaks that people can be outdoors. Well, the shoots are mostly outdoors now, but that people can have safe distance and have a break from wearing a mask. And
I also think that crews should bring their own mask.
oh yeah, well,
Except that I keep hearing, that production will have masks and production will have masks. But I think they should definitely, I also keep hearing crews say, well, I went to look for a mask and I couldn't find one, or something like that.
the only problem with crews,
Or you have your own little person,
yeah,
your own hand sanitizer, your own mask, your own everything, so that in case for some reason you can't find it with production or whatever, you're covered.
I think that's a great point. We're actually
Well,
we're telling our crews to bring their own, and we're bringing it, and we're including it in the per diem. Because like the earlier point, what happens if your coordinator or your producer, whoever's bringing the PPE for whatever reason, somehow they themselves cannot come to set, or something happens? We want to back up for everything. So we've said, please bring your own. We will also have it. We'll include it in your per diem. And also, some people just feel safer.
well, I would say the only problem to both of you with that is if you watch the vapor tests, like people that wore bandanas, and you saw it was in green, the vapor test, and it's just like wearing nothing. And then there's levels of masks, and there's masks that are approved. And I would rather, on any set I had and was bringing people, I would rather control the quality of the mask and the level.
And again, that's why you would bring your own as well.
You bring your own, because if someone has a sort of a handmade cloth mask that doesn't have like a coffee filter and some batting in it, then it's not as effective as the triple weave mask and things like that. So, and Caprice, you had something?
So with all this stuff, just what I heard, you should come to set with your own mask. You need to arrive wearing a mask. So
That's true. That's right.
Bring your own stuff, but also production companies should have them on site in a variety if you want to be nice, and you can, because I heard, you start sweating through it, you're going to need another one. You can go through 3 masks a day.
Easily. Like Lynn was saying that there's a zone, which, thank you for that, Lynn Hughes. I thought, a zone that's of contaminated stuff and then clean stuff. And so you go here to, and instruction on mask. And I mean, we're a video community, we're a film community. We should make like a how to put a mask on safely video. Lynn, you should do that. It'd be a great little.
And also what I learned too is don't buy any N95, because you have to go through a seal test and an OSHA thing. So really the regular medical masks, number 2s and number 3s, that's it. Because if you put an N95 on somebody and they have asthma or something, underlying condition, that's not good. But production should have masks that we can we need another one because we
Yeah.
sweat through it or got dirty or dropped it or whatever, have them on
Right.
set.
Oh, so we only have 3 minutes left.
I
I
mean,
would.
do you guys want to go further than an hour? Or do you guys want to wrap it up in an hour?
We have a question. Jose, please.
No, I was just trying to say that yes, we should definitely go longer. And I'm sorry I was only able to hop in here halfway through. But I wanted to talk about that. It's from talking to a lot of people that are way smarter and have had way more resources than I've had at my disposal. It's not even anymore, especially at a workplace, just masks. Actually having whether it's goggles or glasses or
Or
some sort
shield.
of eye protection.
Yeah.
That has become paramount because of the diversity within masks that people are going through. So, like you said, people that are wearing bandanas, who have
It's not a mask. Yeah.
It's not a mask, right? But people have a tendency of that, like that is enough to a certain degree. So, there's a rate of how far a droplet can travel depending on what mask you're wearing. For example, I mean, like I went what some would consider overboard, and like I got this thing, which already protects me all around, and it has filters. And like even this right now, it's not even enough because it's not rated to what I'm actually waiting on the mail to arrive, which is an actual radioactive gas mask with filters that filter the virus itself, because it filters the size of the particle that a coronavirus travels in. So I actually see into the future of especially if we're inside, having crew and not talent, I'm talking about just crew that is going to need to wear something similar in order to just eliminate completely any kind of risk level so that people can actually breathe, people can actually be protected. But I think that it's not just enough to have a mask, and the rate of mask is very important to
Well,
kind
and
of address.
also face shields just also are great to have. And if you look at the people who administer the tests, they have face shields as well. I mean, that's tough for the DP, but I think a lot of the other guidelines, like only the camera department touches the camera. The G&E goes in early, pre-lights, then only the keys, there's maybe a key on set, and ways of structuring it so there's limited people on set. And then we haven't talked about Video Village. Caprice had talked earlier about witness cameras, or it was on one of the Zoom calls, like so people could sort of dial in and look at the image. And then of course there's remote, like not, yes, go ahead.
I can speak a little bit about that because there's also another concern that has started to take effect, and it's that there is going to be a demand for wireless signals to be sent into production. And that's another concern, because now you're talking about an ever exponential amount of wireless signals being sent in a production setting, and what signals and what items are we actually using, and having what's called a spectrum analyzer box that with somebody on set whose sole job it is to measure the type of signals that are being sent out in a production to ensure that it's safe for people. What nobody's talking about is the fact that 10, 20 years from now, we may be regretting not paying attention to this. And we need to pay attention to that right now. As a camera assistant in the union, for example, I'm constantly with a wireless follow focus. I have a Teradek right in front of me with a monitor. So like I'm having to like worry about this right now, so that later on, if Corona doesn't kill me, cancer might be the one that takes me out. So like we have to pay attention to those things, even though I know that the pandemic is the immediate center of discussion.
Also working in DC all the time, I know from Lenny and Dennis, who are on the call, about all the interference we get from who knows what is shooting around DC. So I would think I don't know if they can weigh in on how all the remote video might affect their wireless signals in trying to capture good sound.
Lenny's like, I am retired. I take great pictures every morning.
Can I just say one thing? Can you hear
I
me?
can.
Terry Gross
I'm
interviewed.
just on here just to listen. I'm not really working, but I know DC there's a RF going on all over the place, and FCC has taken away all the 600 megahertz, so we even have less now than we did 6 months ago. So
Yeah, I remember that was bad. Terry?
But it looks like he's on a spaceship. Terry Gross interviewed Dr. Michael Osterholm a couple weeks ago. I don't know if anybody caught it. He's the. Did you hear, Caprice?
No, but I follow him. He's great.
Yeah, he is great.
He's great. Oh, he's the one that predicted this pandemic.
Right.
And
right.
he, like Nancy was talking about the volume of the spray that goes out, depending on the coverage that you have. What we're not, which I'm glad we moved on to this mask thing, because it's much more important since this is an airborne virus.
Right.
And all the surface stuff. Everybody's focused on cleaning and spraying, cleaning and wiping, but it's the airborne. And
right.
it's the molecules, just from speaking, spread out through the room. So that's the critical. And the 6 foot distance is the minimum. It's really 12 feet that it should be, but 6 feet is the minimum. So that is, but this mask thing is really important. We don't have, they're getting rid of Fauci, they're pushing him away. So we do need to be listening to these real experts, these epidemiologists who are following this. And Dr. Osterholm has said we're heading for a much worse scenario, basically because we haven't been taking care of it. But if you can catch him in a YouTube or podcast of his Terry Gross's interview, she asked terrific questions, and he was very clear, very, very real, very understandable. I mean, it's in Minnesota. What can I do?
Well, I mean, it's a shame that we have to do that and we can't just.
We have to do our own research
from the federal government, but I appreciate, he is brilliant, and I have read his articles, so thank you for that.
Hey, thank you. I'm going to jump up. I went a little long, but thank you all. This was great. I love hearing all of the experiences, because quite frankly, you get in your own bubble and you think you're doing everything. It's really good to hear what other people are doing, and I appreciate it.
Yeah.
Come
Does
back
anyone
next
else?
week, Brian.
Yeah. Thank you, Brian.
And,
We'll see
and
you
kudos
later.
to Jose for bringing up
Yeah.
the other issues, which is really important.
Yeah.
We'll get back to that.
And
Take care.
kudos to everyone for taking the time to be here. Does anyone else have anything else they'd like to
Lisa's
say?
had her hand up.
Okay.
Just wanted to ask quickly, I know in some other webinars, there were some apps referenced for like health screenings or even sharing documents outside of what we've probably used digitally before. Has anybody tried anything new since all of this has happened?
Well, I haven't put, I mean, I've researched the app. So there's the Real Health app that I think is still in development. Go ahead, Terry.
Bye-bye. I'm leaving.
Oh, hi, Terry. Thank you.
Hi, Terry.
Yeah, well, one small thing that I'm doing just in terms of paper is getting release forms pre-signed from talent. So there's no pens or paper being shared, you know, anything you could do like that. Anything that could be done ahead of time so you don't have to touch papers, like, of course, call sheets, daily schedules, all of that, scripts, sides, boards, no more production books, yay. You know, we can just do it all on people's own iPads. So I'm not touching anything that you're touching, but Terry and Jose and Lynn, and I think everyone else is correct that the contact is very, very important, but it is an airborne virus. So the air quality is of utmost importance.
I just wanted to say one more thing before I know people have to go. But you know, it's rewarding to see a lot of producers that actually have the direct line to clients, and that's not something that we generally as crew get to have this kind of conversations. And I think that what has been paramount for me to really get a message across to all my producer friends has been that there needs to be a big push from producers to clients and
Sure.
having them understand that on the bidding process that it can't be done the way it has been done in the past, where the mentality is how cheap can we make this job happen. That has to go. That mentality has to go out the window, because now you really are trying to spend thousands to save pennies at this point, and it's gonna cost shoots. It's only a matter of time. It's not if, it's when. As much as we want to plan ahead for all these different things, it's just going to happen, because we're human and we're going to make mistakes one way or another. But so I want to put it in everybody's head that clients need to start understanding that we can't be doing the same things we've done in the past.
Totally agree.
Yes,
Totally.
Lynn Hughes?
Hey, Nancy, I just want to say to Jose's point, I've started negotiating on the front end, and especially just to let clients know the more risk there is, and by risk I mean if you want a bigger crew, if we're going to be indoors, that there is going to be a premium for that they can't ask for cheaper and more intense in this current environment, and that whatever we do, there's going to be a dollar cost for all of the protections we have to make on set. And I've started putting PPE costs as an upfront in billing as well.
Okay, well, does anyone else have anything they want to say?
Well, I know, I think it just feels like, we bring up one question and it brings up 5 more questions. I mean, we could be here for, 3 more hours, but yeah, I just we're going to wind down. We've got 2 more weeks of webinars. Like I said, next week will be locations. And that webinar, that Zoom call, we're going to talk about zones and, the stuff that we got to figure out. And then the following week will be vanities, and that Zoom meeting will be vanities as well. So please just help. It's so nice to see Dennis Towns. I always say, where in the world is Dennis Towns?
Bye, Dennis.
Hey, man. And Mary and Lynn.
I know, it's all.
But please help me spread the word about the webinars, because I'm just trying to. This is a bit of an outreach too. So try to please spread the word. Everything's archived on DC Camera's YouTube page. The previous stuff, if they couldn't make it or didn't know about it, but please just try to help spread the word. That would be great.
I've seen every
I would start posting on this Facebook group called Nat Geo Happy. There's a lot of traction there, and there's a lot of folks that, if you're not, I don't know if you're a part of it already, but
Which one?
It's called Nat Geo Happy, and it's a really big community of people that work within the DMV, and producers, camera, sound, all kinds of different departments. I actually posted your link to the last webinar.
Okay.
And so if we do that weekly, I think we're going to get a lot more.
Oh, that'd be great. I didn't know about it. Is it our community?
Yeah.
I was going to say, if it hasn't been going out on Nicole Haddock's two groups, that I need a crew and I need an editor, I could see a lot of folks in there that are very local wanting in on this as well. And there's a former Discovery one that definitely goes wider and gets into more executives and people that everybody that used to work at Discovery. So it's a much wider universe, but I could see a number of that could grab folks in other markets that are doing work and have interesting perspectives too. So cross-posting on a bunch of places would be really helpful.
I'm on Nat Geo Happy, and I think it's more like docs all over the world, kind of, even though we're all based here. But anyway, we have
it has a lot of folks that are here that I know haven't been able to listen to it from the surviving the DMV thing. So that's why I'm bringing it up.
Posting the links after the fact at least give people the opportunity to watch it if you don't want to be flooded with a ton of people.
Sharing is great. This is, Capri said it a long time ago, this virus, it doesn't know boundaries. It doesn't know politics. It doesn't really know area. It's like the beautiful thing, the thing I always loved about film crews is they had their special language, so that even if even if you had never worked with somebody before, you could come in and you knew what a baby was, or you knew what an apple box was, or, you know, that I loved that, that there was this whole clan that worked together because they could work safely with that language and everything. I think it should be the same way with COVID. Everybody should share as many links and as much information as they can. We'll all learn. We'll all learn
That's
from it.
right.
Absolutely.
Well, thanks again to Caprice for organizing this, and to Arish for hosting us, and to the whole community in DC MDBA.
Thanks, Nancy.
Bye, Mary.